Good morning and welcome to the National Meningitis Association Expert Panel Discussion event. We're thrilled to be here today in this beautiful site, and we're also thrilled to have all of you here in attendance. And thank you to all of our panelists who've so graciously given of their time. I'm Leslie Meyer, NMA's president. Some of you may know our history. NMA was founded by parents whose families were forever affected by meningococcal disease. We came together because we wanted to protect other families from the devastating losses that we experienced in our lives. We did this by sharing our stories and working with health officials and media to bring disease and prevention information to parents, healthcare professionals, government officials, and community leaders. And that continues to be our mission. Though our focus is meningococcal disease prevention, as an organization, we support vaccination across the lifespan, and we work with many other infectious disease, vaccine, and patient advocacy organizations with the goal of increasing vaccination rates to eliminate vaccine-preventable diseases. During today's event, we will hear from experts and advocates during two separate panels. We'll start the event off with a discussion about the power of personal storytelling in vaccine advocacy. And then a little later on, our second panel will address some of the challenges and potential solutions when it comes to vaccinating older adolescents. Conversations like these are so important to all of us in the public health and immunization communities. They provide us with the opportunity to join together to ask questions, share best practices, and learn from each other's successes as we work toward our shared public health goals. I'd like to thank all of our panelists and moderators for taking the time to participate in these conversations with us. And I'd also like to thank everyone in the audience for coming out this morning. Please give a warm welcome to the moderator for our first panel, meningitis survivor and NMA advocate, Francesca Testa. Okay, now,
Yeah. All right, thank you, Leslie. Thrilled to be kicking off the first panel discussion this morning. And I just wanted to quickly start by introducing each of our panelists today. So we first have Dr. Noel Brewer, professor of health behavior at the University of North Carolina, who's going to give us some insight into how parents make choices about vaccines. We also have Stephen Ferrara, who is the associate dean of clinical affairs, as well as a professor here at the Columbia School of Nursing. We also have Dr. Catherine O'Neill, who's the medical director at Bucknell University, which saw 2 cases of meningitis B during the fall of 2017, and she'll be getting into that a little bit later. We have Ethan Lindenberger is a 19-year-old vaccine advocate who made headlines about a year or so ago when he sought out advice on his own about getting vaccinated, which his parents had always opposed. And lastly, we have Patsy Stinchfield, who is a pediatric nurse practitioner at Children's Minnesota, who specializes in vaccine-preventable diseases. And she'll also be moderating the second panel discussion a little bit later this morning. And because the theme of this panel is storytelling and the power of our personal stories, I just wanted to start off by sharing my personal experience with meningitis. I was a senior in high school when I contracted bacterial meningitis. It was in 2006. It was April of 2006, and I was getting ready to finish out my senior year of high school. Very excited about senior prom and hanging out with my friends and looking forward to college the next year. And I had just returned from a national swim meet where I was competing down in Florida. Within 24 hours, my life pretty much changed forever. I woke up one morning not feeling well, had some typical flu symptoms, fever, headache, body aches. So I went to one of my local pediatricians. And when I got there, they diagnosed me with the flu. They sent me home and had my mom give me fluids and, of course, rest for the next few days, and you'd feel better. And within about 12 hours from that point, I became completely unresponsive. I was unconscious, and my mom found me in my bed that morning. I had purple rash that covered my whole body from my head all the way to my toes, and I was immediately brought to our nearest medical center by an ambulance. as soon as I got there, they immediately knew that they wouldn't be able to help me and that it was something that was much more serious than the flu. I was immediately airlifted to one of our local intensive care units, where at that point they diagnosed me with bacterial meningitis, and they gave my parents about a 20% chance that I would survive the night. Although I did survive, I do live today with long-term complications of hearing, vision loss, cognitive delays, and also severe headaches. And although I was in a coma for about 2 weeks, I was on life support. I'm thankful that I came through and that I'm able to speak to others, especially high school age students who, are kind of in that point in their life where they're getting ready to go off to college, and that was the age that I was when I contracted bacterial meningitis, and I hadn't yet been vaccinated. I was scheduled to have my vaccine about 2 months after I actually contracted it. So, it's just so important, to tell our stories and to make sure that others understand the importance of this vaccine, but also all vaccines and the impact that vaccine-preventable diseases can have on families and those in the long term. So with that, I'd like to get into some of our questions for our panelists. So I did want to start off actually with Ethan. I was wondering if you can tell us a little bit about your story and kind of comment a little bit about how your story has been received.
Yeah, so jumping off of what you were saying with personal storytelling, I think that my story and my experiences and what I do kind of is rooted in that, because like the introduction stated, my mom is an anti-vaccine advocate. And so after I turned 18, I got my vaccines and just shared that story about a personal decision that was rooted in science and not in, fear and panic. And so through that story, I was able to give a testimony and speak at a TED Talk, even go to Belgium and speak at a European Union Commission meeting. And so all these different experiences just came from a storytelling perspective and not a scientific discussion about a nonprofit or about a study. It was just a story. And so with those experiences, I really can relate to that. And I think that's just really what I do. It's just expressing how important stories are and expressing how important it is to uplift stories of advocates and young people especially, so they feel empowered. I'm also really interested, and I'm sure many others are, how did you kind of come to that decision, to go in a separate direction, from your mom growing up? Yeah, I think a lot of it, and it's a little redundant, I think a lot of it is from stories, and it's from personal experiences. I was hearing from individuals that suffered from vaccine diseases, vaccine-preventable diseases, and about how my mom was expressing her views in ways that didn't really make sense. And so I would, speak with her and say, well, why do you say that vaccines cause autism when the CDC disagrees? And she would say, well, the CDC wants you to think that. The CDC is an organization that's bought out by Big Pharma, and that didn't make a lot of sense to me. And on the flip side, I was seeing stories from people that had survived these diseases that are extremely dangerous and threatening to society at large, not even just their own lives. And I was seeing that statistically it was so much less of a threat if it was able to be vaccinated against, and the vaccine rate was higher. And so the stories along with the evidence really showed a much stronger case than what my mom ever presented. And I was also seeing how when I went to school, everyone was vaccinated, and it was a huge deal. The principal would pull me into the office and say, you're a health threat to this school if you don't get your vaccines. And I was like, why? That's weird. I don't get it. And so those questions and those stories and continuing to affirm how important this was really led me to just do some research on my own.
And how was, kind of your decision and everything that you've done since then as an advocate, how has that been received?
It's been received really well. I think that anecdotes and personal stories can sometimes be disputed within the scientific community as important or even as valuable when you're talking about a discussion that's so dense, such as vaccinations. And so when you're talking about a personal story like me and a personal experience and anecdote like with what I do, it may be less effective at reaching some people with scientific mindsets, but normal everyday people will really resonate more with that. And so when I went to my testimony and said hey, vaccines are safe and effective, I saw the evidence, it's right there, and here's my story, that was more effective in reaching some people than just this really dense study with 600,000 people, which makes no sense. That's totally backwards. But I think that it's been received really well by everyday people, and it's been a discussion point for individuals that we're trying to reach in the scientific community and that are questioning, that are curious, that don't know if vaccines are safe. The more personal stories, it's easier for them to understand and to digest and think, man, maybe I'm missing something. So.
Great. For Dr. Brewer, can you talk to us a little bit about how parents might go about making decisions about vaccines? And do you see a value in people like me and Ethan telling our stories?
Sure, there's a lot of things that inform the decisions, really behaviors that people engage in. Vaccination is a behavior, and it may or may not be based on a lot of thoughtful decisions. So the three general influences that we think about are information and education. That doesn't have a lot of influence on people's behavior. There's a recent summary of studies showing that risk communication specifically, trying to scare people, is not effective for changing people's vaccine decisions and behavior. Another influence are these behavioral nudges, setting up policies and procedures and programs that make it easy for people to get vaccinated. Those are effective. Things like text reminders, calling people back, setting up systems in clinics where people can get vaccinated easily without much hassle, setting up default appointments. All those things work. There's a third area, and that's a third area where as scientists we know very little, and that is the social interactions that people have through storytelling, through social media, and in other ways. Those are also potentially very powerful. We know that the single biggest predictor of vaccine uptake of any kind is a provider recommendation. And that might be your primary care provider, but it could be a nurse or it could be another person like that who has healthcare credentials. That's by far the biggest influence. What we don't know is why it works. And it might work because of this social bond that you have with that provider and the respect that you have for them. So in terms of storytelling, I do think storytelling is incredibly powerful and relevant in that context of the social dynamics that people have. We know that just sharing information with people is not enough. It has to be shared multiple times through multiple different connections. And so if you have a social network where there's several people talking to you, you get this thing called complex information contagion, where multiple people are sharing things with you, and then it starts to shift your worldview. The world that you're in starts to change, and that can then change behavior. But just sharing a fact with someone is not enough. So one of the things that I've done as chair of the National HPV Vaccination Roundtable is we have established videos of cancer survivors, HPV cancer survivors, to talk about their experience, to make this real, to do the storytelling that you just did, and to give a voice and a place for these folks. And we've also recently, right now we're in the middle of creating a YouTube channel to help give a place for our videos as well as other videos all in one place so that people can find them.
Excellent, thank you. Stephen, your interest in meningococcal vaccination was piqued recently when you had heard a story from a mom who had lost her daughter to the infection. Could you tell us a little bit more about that?
Sure, thank you. So I was in Albany, in the capital of New York, speaking to legislators that day about eliminating the religious exemption for vaccination for school-aged children. And I came across, there were a bunch of organizations there, of representatives there, and I happened to speak with Patty Wukovitz from the Kimberly Coffee Foundation, and Patty lost her daughter to meningitis B on her 17th birthday, while she was 17 years old, and that story certainly resonated with me. And here was a young adolescent ready to go to college. She wanted to be a pediatric nurse, and she contracted meningitis B, and did not survive. So I took that and I said, how can I tell the story, or a story that was important to me? So I have a love-hate relationship with social media, and as most of us do. And I've over the years I've used my Twitter account as sort of a way. It took me a while to figure out what I wanted to use it for, but at the end of the day, I said, I'm a nurse practitioner. And year after year, the Gallup poll comes out, and nurses are the most trusted profession every year. And I said, how can I use this platform to tell stories or to give a nurse practitioner's perspective on issues that are out there? So this past summer, I did a tweetorial. And a tweetorial is basically a number of tweets that are threaded together. And it was on the meningitis B vaccine. My history, I was actually, one of my first nurse practitioner jobs was at Fordham University in the Bronx as Associate Director of Student Health Services. So I was speaking to college students all the time about meningitis vaccine, but while I was there was no meningitis B vaccine at the time. So I did this tutorial. And it got some attention, certainly not a huge impact. I think that's part of the problem with social media is that there is so much information being thrust upon us that it's hard to sort of figure out what's important and is just noise. But that to me was really, really impactful and powerful.
Great, thank you. Great. So for Catherine, so vaccines, I guess, have kind of been a victim of their own success. Parents today aren't seeing the vaccine-preventable diseases that much earlier generations had. So would you be able to talk to us a little bit more about the meningococcal cases that happened at your university and the impact that they had on vaccination attitudes, in the greater community?
Sure. So the university that I'm at is fairly small, which is good and bad. We have 3,700 students. And when we had our students that were affected with meningitis, it really put a stop on the community. We had students from all over the country, so we've been very strict with our immunizations from the standpoint of we have communities of athletes who are Division I. We have 28 Division I teams who travel all over the place. So it was very important that everybody be vaccinated. And we actually hold out room keys so that folks can't get their room until I speak with them if they don't have their vaccinations. We will give them their vaccines and then they can go to their room. They come back for their boosters. So when the meningitis cases came through, this was 2 years ago, and it's when meningitis B was just kind of getting heard, right? A lot of family practice physicians didn't really even know there were 2 vaccines. There wasn't a lot of information out there for parents, for sure. Parents knew that their children had the meningitis vaccine. So when we got the first phone call that there was a concern for a meningitis case, our first thought was, hey, we're in pretty good shape. Let's take a look. Let's see who isn't vaccinated. Got the list. We were ready in case we had to mobilize. And then we figured out, oh, the person who has been identified already had the meningitis vaccine. This is odd. That was the first time anybody even thought about meningitis B, right? So then it's, oh, crap. Well, let's see who has meningitis B vaccine. Hardly anybody. We had a very long time period. I say very long, it felt like forever between the first student who was identified and the second. It was a 5-day time period. It was over Thanksgiving break when nobody was around. And then there was the inability to really communicate to our community, right? We had to go by what Department of Health was telling us to do. We had our concerns. We could communicate directly with a roommate, but the first student wasn't able to communicate that he'd also had many other exposures that we should be talking to. So all of that kind of pushed forward into a concern for a greater community that we weren't able to really give the information that they needed. As the second case came, and I think we'll talk about that at the second panel, we were able to then get all the pieces put together and then telling the story from a parent's perspective of here they had a relative picking up their sick child and thought he just had a cold. Next thing, they're half a country away trying to fly to meet with their son who may be dying of meningitis. That story in that athletic group was so compelling that everybody from both teams in that particular athletic group, which was the crew team, were getting their prophylaxis, were getting their meningitis B vaccine. They were in, within their Christmas break, getting their second vaccine. So that story was so compelling, it was extremely easy. Now, when I get the phone calls from physicians who don't want their student who's coming to my campus to get their meningitis B vaccine, and they start to argue, this is extremely rare, I don't know why you're pushing this, other colleges don't require this, I say, I've had 2 students who've been walking around on this campus with the disease. I don't want to risk it. This is my family here now. I think you need to get them vaccinated.
Great. And I mean, for my personal experience as well, you know, when I first contracted meningitis, especially in our local community, it was definitely, you know, there was a lot of nervousness. There was a lot of panic initially. So there were a lot of folks that were going, you know, I'm going to get my child vaccinated. Let me make sure I have them. Now that you've been about 2 years out, do you find that it's that same type of reaction as opposed to kind of maybe that nervousness when the 2 cases first came out? And do you find any other challenges now that you've been a couple years out?
Yeah, actually there is. I was speaking a little bit earlier with one of our panelists here. There's been, and I think it's a kind of the next generation because of social media who are coming in. I have a larger group of folks, and it's not large, but compared to 1 or 2 over the last couple of years who maybe were against vaccines, now I had 5 to 8 who had no vaccines, and having that discussion is different because of things that have come across with social media. So I find when I'm having the discussions, it isn't as much as it used to be that I recommend this, I want you to be safe, but I have to combat a little of the information that has been there already. But falling back on, if this were my child, my cousin, my nephew, I would give them the vaccine. I've seen it. I've seen what it could do. If you'd like to speak with the parents of the 2 boys who struggled with the disease, I'm happy to let you do that. But this is what I recommend. And it's been successful. It's been successful. It is a little harder work, though, right? In the moment, absolutely. Everybody was vaccinated. We vaccinated around 15% of our campus just with our vaccinations, and those were over break, so they went home and also got vaccinated. But it also has shown an uptake in our flu vaccination rate, right? It's compounded over things. HPV vaccination, we did show the documentary, which is phenomenal if anybody gets a chance to see it on HPV. That was so impactful to be able to see folks who were their age, relatable, different situations who they could then make a change in their life, right? Get the vaccine, prevent getting those particular diseases. So it's both. I've had more come in, but yet I'm seeing a trend now. It's kind of cool and popular. We've made contests between the teams to get vaccinations, those kind of things.
That's great, thank you. And for Patsy, so you were a voting member of the CDC Advisory Committee on Immunization Practices. So can you tell us a little bit about how hearing personal stories, has affected or continues to affect the committee members?
Sure. So thanks for having me today. I'm mostly Irish, so I think I'm genetically predisposed to storytelling, and our family highly values it. So yes, I value the stories. I value the stories of firsthand voices. So I'm just going to take a second and describe what ACIP is and my role on it. So I have the ACIP Advisory Committee on Immunization Practices is the CDC's governing body that makes immunization policy for the United States. So in 2004, I became the first nurse on the voting panel. And if you remember, the first meningitis vaccine was voted on in 2005. So this was really my first kind of analysis of a topic. And I got to ACIP as the first nurse in the United States, not as a great researcher of vaccines or because pharma sent me there or whatever. I got there because I'm a nurse practitioner at a children's hospital that takes care of the sickest of the sick. And in 1989 and 90, had to lead our hospital through an enormous measles outbreak. I've had to lead 2 more since then. I'm still there, 32 years later. And the stories of these families of why they didn't get their vaccines was so curious to me. Did some public health outreach and trying to figure out, and it was the schedule that was complicated for people. And it was the providers who had lots of missed opportunities. They were there in our clinic and we didn't vaccinate them. So went on to talk more about that, spoke at conferences, was nominated by NAPNAP, the National Association of Pediatric Nurse Practitioners, who I still represent as a liaison, to just talk about what it is like in the field. So I'm Practical Patsy at ACIP, they call me, because I'm not there. I'm paid by Children's Hospital as a salary to do my job there in infectious disease and direct the infection control department. Coming in and as a voting member, it's really incredible. The amount of research that you get, the data that you get, the work groups that do the work outside of those meetings is such an incredible gift to the United States. Some of the best minds thinking about this. And then there will be many presentations. So the ACIP is 3 times a year, on October, February, and June. And you lead up with lots of different science, but then also there's public comment. And it was in those public comments that families who've been affected by meningitis would come and speak. That's where I met Lynn Bozoff and the Bozoff family, and many, many other advocates telling their story. As the vote approached in 2005, I started hearing from some people like, don't make an emotional decision. And I was like, what does that mean? I don't think I can separate my whole self. And so I would listen to stories, and of course they were very impactful. Also being Irish, I had to fight tears many times. The family stories were very, very important. Now, as it came in, you're balancing the data, you're looking at the incidence, you're looking at the cost, you're looking at the impact to the family, and how can you put a dollar amount on the impact to a family. And then we need perspective of, well, what else do we spend money on in the United States? And so it was sort of, for me, an ethical decision that usually what happens is the chair of the work group makes the motion, and I'm happy to say I seconded the motion in 2005 that went on to go vote, and now we have a routine meningitis ACWY, and then, of course, the Men B. But having that ability to influence by way of the stories of children that I have seen in my own hospital, kids who have died, staff that are terrified when they take care of somebody with meningitis, and knowing that this body makes such a difference, and they do it on science, and they do it on the perspectives that are what is best for families.
Great, thank you. And I know you all touched a little bit about this, but I'm wondering if we can talk a little bit more about really why the scientific evidence around the success of vaccines is just not enough to counteract the anti-vaccine movement as a whole.
I think the evidence is strong. I think it's effective. We have high rates of uptake. Meningitis vaccine has reached and exceeded our national goals. That's good news. At the same time, the success we've had for vaccination across many vaccines is threatened by the apparently growing voices of the anti-vaccine, again, so-called movement. These are folks who are relatively few in number, and they're very loud. They're also very effective. They've been telling stories like this since vaccines first came out. Instead, what scientists have been doing is we've been bringing our calculators. We bring a couple numbers, we bring a really yummy journal article, as you were saying, these 600,000 people studies, and we talk about how cool they are, and maybe we can even work in an odds ratio and a confidence interval if we're on a roll. Instead, what we need to do is we need to be able to talk in real terms, talk about things that evoke emotion, that evoke feeling, that evoke horror or disgust or anger or sadness. Your story that you were telling for me was very powerful, imagining being a parent, and your child is in the hospital. You talk to her 3 hours before, 4 hours before, and I get choked up thinking about it. And the idea that all of a sudden you're in this very medicalized place, your child, your daughter's unresponsive. It's a day, it's another day. The sun rises, the sun falls. This goes on for 2 weeks. And you've heard that you have a 20% chance of ever talking to your daughter again. It's so powerful. So the idea that affect gives meaning to facts is something that's central to what we're talking about here today, is that facts don't have any meaning on themselves, but facts with feelings definitely become meaningful. And it can also be hard to show emotion. To show anger is easy, but to show vulnerability and sadness is really very powerful. And although sometimes it can create a socially awkward moment, you can say things like, I'm okay, I hope you're okay. And then you can continue with your story.
Thank you very much. And I think that, especially from a parent perspective as well, in my experience with my parents, I think it's, I think it's very powerful when they, talk to other parents. I think it's very powerful when they talk to practitioners as well. And I think that you're not necessarily going to get the same effect just from, giving statistics. So I think having that balance between both is something that's really important, as our anecdotes should be backed, by some sort of scientific fact. But I think having that combination is really successful. And something that, Patsy, I know you had mentioned, early in your conversation is, how, in some respects, the frustration with some practitioners about how they had folks in their office and they let them leave, right, without having that conversation. How do you think we might be able to kind of tailor our stories to different audiences, or, and really for anyone, and how we can reach maybe those medical professionals in a different way, or, and how we can harness that power?
Well, I do think, as everyone's saying, it is that combination of facts and the data, but it cannot be the data alone, and it is the storytelling, but it cannot be the storytelling alone. It has to be that combination, and I think that clinicians are the public too. If you don't know that, try to talk to them about getting their flu shot. They need the same kind of information that we want to give to our parents. I think measuring the success of their clinic outcomes. Sometimes they think, well, we vaccinate everybody. We vaccinate everybody who walks in here. It's like, well, let's look at your data. So here's how many patients are in your panel. Here's how many that you gave to the MenB vaccine to, and they're pretty surprised. So I think sometimes the data for clinicians is powerful on what their success is.
Do you also believe that educating the support, nurses, front office staff, I think having that total approach, because there are so many things to address, especially when you're dealing with this age group, when they come in for a visit, I think if you have a general consensus of what your feel is and how you want to protect and all of those things that you want to accomplish, and that's coming from the person scheduling the appointment saying, oh, you may be due for a vaccine, you're 16.
Totally.
And back to the nurse so that the provider is teed up.
Absolutely. I think that theme and that message, and that you're in a place that doesn't like disease. You're in a place that doesn't want to see harm. You're in a place that is going to do everything that you can to protect your child, your family. You get that sense, and you should get it from that first phone call to the last person who gives the vaccine.
Mm-hmm. I think there's a real opportunity in medical education to bring storytelling along. So we have something we call the announcement approach. It's a 1-hour training to train providers to recommend HPV vaccine, meningitis vaccine, and Tdap vaccine efficiently, to do it all at once, saying something like, I see your child's 12. Sophia's due for vaccines that prevent meningitis, HPV cancers, and whooping cough. We'll give them at the end of the visit. Do you have any questions? It's that simple. Now, what we also do, in addition to giving them that technology and also how to talk to hesitant parents, is we put in there a video of a young woman who has cervical cancer. It's a minute long, and it brings the reality of the experience into the room. It's no longer just a number, it's a person who's experiencing it. You see her husband, you see the progression of her disease, and by the end she's passed away. And it's very powerful, but again, it's a minute. So I think there's a real opportunity for medical education, for CME, and so on, to bring videos or bring the actual folks there, the folks who've been affected by it, the folks who are family members of those affected.
Great, thank you. And maybe for Ethan, but how do you think that we could really tailor our stories maybe more to teens, or what approach do you think we can take to really make that message more effective?
The age-old struggle to reach the teenagers. as technology advances, it just like separates more and more. But I think for teens, especially as a demographic, the idea of trying to disconnect from academic language when trying to tell a story is really important. Because I feel like teenagers especially really shut down when they're spoken to in academic terms, in an academic language, and not in a personal setting with the stories that are being told. Because when an academic field tries to speak in academic terms in a personal story, it doesn't meld very well. So a personal story that revolves around a very personal struggle or individual that like a teenager or demographic can relate to is the most important. And I do agree that data needs to back that up, but I think that the data is the foundation for what we believe, and then we tell the stories based off of the experiences of that data. And so instead of numbers, there's people. And instead of a case study, there's an individual who lost their life. And I think those are the kind of stories that will resonate with teenagers, because they're not people that want to lose their lives. They're not people that care about their families and their friends and their community, but they just don't see the importance of vaccines, because to them it's just a mindless shot they get that is kind of an inconvenience. And so when you take that and flip it on its head and say, no, what we're doing here is going to potentially save your life, potentially save someone else's life, and potentially keep your community safe against an outbreak, and it all starts right here in this office, that is going to be way more moving to anybody, even teenagers. Even though they're the most selfish people you could ever talk to, younger people still care about their communities and their families and about themselves especially, and so they don't want to die. And that's the thing I always tell people is that, like, you know, for me, the thing that resonated was that, you know, vaccines didn't just protect me, but it could potentially save someone else's life, especially the vulnerable, you know, children and elderly people that could lose their lives to a disease that I spread. And I think when you speak in those terms and say, do you care about other people enough to go through this single shot that can be the defining factor in someone else's life? And I think that's just a really simple way to convey that to anyone, especially teenagers.
Can I follow up, Ethan?
Yes.
Is that okay?
Yes.
So your family story is just so fascinating, and just on behalf of all of us, thank you for your bravery and your dedication to all of this. Both you and your mom went to social media.
Yes.
And you came out with different outcomes. And so what can we learn from that? Do we need to be teaching more science earlier on? Talk a little bit about that.
Yeah. I think social media is quite the unique topic, and I think even though I'm 19, I still have a very unique perspective. I spoke at a panel with the Ohio AAP and said I wouldn't allow my 16-year-old kid to have Facebook because I just hate it so much. Everyone's like, yeah, and all the teens on the panel were like, this guy's crazy. And so I've always been very cautious with social media, and ever since I've used it, I've always had a very strong disconnect from my personal life and what I share online, because I know that social media can have very negative impacts on mental health and emotional health, and can really stunt the growth of an individual. But when it comes to information online, I'm even more skeptical of that, because when it comes to scientific and medical information on social media, that should almost never have the same importance as a medical practitioner what their advice is, you know, and we'd all love that to be the consensus, but it's not. Most people statistically on social media use it in some fashion to look at medical research and advice. That's just fact. A lot of people do. And when you see that and you see there's so much misinformation that's spread, you can see how someone like my mom came to the conclusions she came to. You can also see why someone like myself came to the conclusions I came to. It just depends on where you go. And I think that that's the danger, is that when you go to a medical practitioner, you go to your doctor's office, you go to the hospital, you will get the same consensus from the same medical practitioners and people that are scientifically literate. At least we hope so. And it's like that's what we want. We want the medical consensus to be consistent. We want it to be a consensus. We want everyone to come along and say this is what's true. But on social media, that's not the case, depending on where you go. So for that, I always tell, you know, doctors and pediatricians and anyone in the medical field that they should have a presence online, especially talking to younger people if they can. But not everyone, you know, enjoys young people. Not everyone can speak to them as a demographic, and so it's a challenge. But I think also on top of that, I think that, you know, some of the stuff we talked about, like the legislation, the specific guidelines on these social media platforms, is really, really important, and we're continuing to see it get better. You know, just in the past week, Jack Dorsey had said that Twitter will no longer allow political advertisement on his platform. And that came from the CEO saying, we just believe this is what we should do, and they're going to lose a lot of money doing that. And so those strides and those steps will continue to influence other social media platforms, but it takes also us as scientifically literate and concerned people to put pressure on those companies and say, we need to address this misinformation, because my mom will probably never change her opinion, and she is going to be lost to this misinformation probably for the rest of her life. And so that is inexcusable, and to convey that is one of the most important things we can do. So.
Wow.
My tangent's over.
Isn't he impressive?
Appreciate it. Thanks.
For sure. Thank you. And I do have a couple more questions, but I just want to remind you that if you have any questions throughout, definitely feel free to raise your hand and feel free to interrupt us. So, with a lot of your experience as well, when we start to look at like state, local legislators, even local school districts, things like that, how do you think we might be able to tailor the message to them? Or if any of you have experience working with them, what might resonate the most?
Oh no, this is the hardest question ever. They're so old and they don't like vaccines. Like, that's my experience. So many politicians, representatives don't care. Like, and that's the struggle, is that you need lobbying groups that are funded by millions of dollars and they still can't even get a conversation with half these people. And so I think, like, when it comes to politics and representatives and senators, the biggest thing is just to continue to try and address the culture and how it's just not, how diseases are still spreading. And so it's like, hey, you might not care right now, but if your son got measles, you'd care a lot more. And so I think that's like one of the most important things to do, and how to convey that. I don't know if anyone else is.
And how we try to protect our military. Right?
Yeah, right.
They get vaccinated.
I think one important
wouldn't
thing
we?
on the political side is for us not to get drawn into political battles. Currently, vaccination is widely endorsed across the political spectrum, but some vaccine policies are not. So, for example, vaccine requirements polarize right-left.
Yeah.
And it's really helpful for us to maintain vaccine as a public good, something that the entire public embraces and sees as a good thing. I think we should withdraw from challenges that polarize it and allow us to give vaccine to one side or to the other side.
Right. I would say quickly with that too, with mandates on public schools and those kind of political movements that are really, really important for vaccination rates. That is very polarized, like you said, between different political spectrums, and also depending on the geography where you are. Because in Ohio, we still have both philosophical and religious exemptions, and obviously that's something that's a point of contention with a lot of different states. And so in Ohio, it's not a thing that's like going anywhere soon. A lot of the representatives don't really care enough, and they say it's a personal decision. The parents should decide. And this is the concept that needs to be addressed. And so those lines of thinking of like, oh, it's a personal decision, it's not impacting anyone else. It's like, no, it is, and here's why you're wrong. So even though that's not a political statement in my mind, that's just a factual scientific stance on the issue that has become political.
I think the other unique thing about it is that this is about the public good and about public safety. So, I might want to drive fast. I might want to skip the red lights because I got to get where I'm going.
You don't?
I don't, thank you. I might want to, but I never do, because I might harm myself and I would harm others. And so I think legislatures know that we've got to protect the public. So you have, driving laws, you have drinking and driving laws, you have indoor smoking laws, and we, state by state, is really up to each individual state. There are no overarching federal laws other than what the CDC recommends. The implementation of that is really state-based in terms of exemptions and things like that. But keeping our eye on why we do this, we are trying to prevent disease, and how we do this, that we do it for the greater public good. There are some people, babies younger than 6 months old, can't get a flu vaccine, can't get some of the vaccines we're talking about. We have to protect them. How do we protect them? By protecting ourselves. And so I think it's sort of keeping it simple and trying to keep the politics out of it, but thinking about it more as our kind of social contract with each other.
And I think it's important when speaking with legislators is that we speak to legislators. When I was in Albany, I was sitting down with a state senator, and they track area codes of people who call them, and they've noticed that none of the people who lived in this district in Long Island that has millions of people in it, nobody called and gave their story. They were tracking stories from across the United States, people who were coming out and saying, don't vote for that bill and all this, but they didn't hear from anybody who was a supporter of the science, of the stories that they needed to hear. And I think that, what do politicians do? They tell stories. They tell stories of people who contact them, and I don't think we do that enough, just to tell them our perspective. I mean, there are elected leaders. We should be reaching out to them for anything, and whether it be a single issue or something, more expansive, they need to hear from us, and we need to be that voice.
Excellent, thank you. So kind of a little bit of a turn here, but in your opinion, and in all of your different backgrounds, how far can or should healthcare providers go when it comes to urging parents to get their children vaccinated?
Well, I think it depends on your position, right? Like my position is unique from the standpoint of I have my community and how I want to protect it. But I could see how that could be related to a primary care practice as well, right? When you talk about protecting your collection of folks, at the same time at a primary care office, you're going to have a diabetic, an asthmatic, a cancer patient, all kinds of folks who are ill, and if that person continues to come in and not be vaccinated, they're at a higher risk of exposing all of those folks who are immunocompromised. So I think that providers can go very far, and I've spoken with providers who won't take care of folks who are not vaccinated because of the risk to their population. And that's how I approach it at the college. We are getting folks, thankfully, who with chronic illnesses are able to come to college. We have resources now that are amazing. You can get medications, infusions, all kinds of things while you're still taking courses. But they shouldn't be at an increased risk for coming because somebody else has not taken advantage of the actual protection that they could take. So I think you can go as far as you want to go.
So I think it's important for providers to start out expecting it's going to be easy. And for most parents, it's going to be easy. It can be a short conversation. It's part of routine care. Mention the vaccine, say this is part of our usual care. We're going to do it today. You're good. Then if questions come up, you can start to address them. The key thing about making it quick is you're not holding all parents hostage over a few parents' disagreements. So you're able to take the children who have asthma, who have diabetes, and create time in your schedule, in your clinical flow, to take care of those kids who really need this help, who really need more of your time, and let parents decide where they want to spend their time. If they want to spend their time with you about vaccination, then you'll go there. So start off with something brief, then move on to something fairly structured. Try to figure out what is their main concern. Regardless of what they raised initially, get to what their main concern is, and then mirror back to them that you heard them. As a clinician, that you actually heard, either using the phrases they said or in some way expressing understanding, or saying, well, if they're saying something wild about the vaccines and safety, you can say, well, look, we both want the same thing, it's to protect your kid. There's no question about that. Now let's talk about what you just talked about. Okay, that's the second piece, and then you're done. That could be in a few minutes. Now, a parent may say no, and that's fine. Let them go. Don't fight the fight that day. Bring them back. You'll have to make a clinical note, bring them back, and then fight the fight the next time in some brief way. At some point, the provider's going to have to make a decision. Is this someone you want in your practice? And increasingly, pediatricians are deciding to not have families who don't vaccinate in their practice. I think that's a very complicated issue. I've not really come down one way or another, but I appreciate that that's a decision that some practices make. When I take my son in to get vaccinated, I am relieved that we don't have kids who are not vaccinated there. That's something I'm quite relieved by. Our next door neighbor had whooping cough, and my son wasn't even 2 months old yet, couldn't even get the vaccine for that. And so there we stood in our house figuring, now what do we do? The kid's got whooping cough. Is it safe to walk out the door, and sort of going through all the mechanics of that? So that's going to be something that's particular to the practice of making the decision. But I think it is really important to go in comfortably and expect that you're going to have a comfortable conversation. A third of providers won't talk about HPV vaccine routinely because they expect it's going to be a weird conversation. They don't want to deal with it. It doesn't need to be weird. It'll be straightforward. Same thing for these other vaccines.
I would say the other advice is to put some structure around it. So at Children's Minnesota, we are 2 large children's hospitals, St. Paul, Minneapolis, and 12 clinics around the 7-county metro area. And we have a vaccine committee, and we meet right after each of the ACIP meetings. And we've debated this. Should we close our clinics and just have it for people who want to vaccinate? And we talk about it annually. We have an ethicist who joins us for the conversation. And the answer we come up with kind of easily is no. We are here for all children. And keeping our eye on our patient is the child. Now, we need to work with the parents, of course, but our duty is to the child. And if they come back and back again, we can have that conversation. and making sure that we do raise the vaccines. And as has been said, the vast majority of parents immunize on schedule. And so it is, for the most part, a pretty straightforward conversation. And then there's the 1 to 3% that are absolute refusers. You don't get very far with that group, but it's that middle sort of 20% and growing that are confused, they don't know what to do, they have a lot of questions. That's the people we need to make sure we take our time. If they say, I really don't want to do vaccines, and we close them to our clinic, where do they go? They go with other people who also are not vaccinated, so it actually becomes a clustering of unvaccinated and therefore a bigger public health threat. So if measles or pertussis or whatever gets into that group, we now have it in our community. And so we keep them in the fold, and when there are the kind of difficult, long conversations that you don't have time for in a well child check about vaccines, I have special 2-hour appointments in my ID clinic, and they come and we talk over what the next best steps are. Yeah, 2 hours.
That's awesome.
Yeah.
Great, we have a question.
So children, are different developmental ages and stages, and so for adolescents, yes, we do talk with them and work with them directly. That's an interesting legal question too. So if you're 16 and not of age, and you want a vaccine that your parent doesn't want, each state law has language around what the state would allow you to do. So we do try to talk with adolescents alone, and we try to talk with them with their parents. Younger kids, of course, kindergartners, that's a rough visit. There's a lot of vaccines, and you talk about we're trying to keep those bad guys, those germs away from you, and you're going to be healthier and better because of it. So depending on their developmental stage, we definitely will include them in the conversation. Education in a formal way, education material, yeah. So there are lots of different things out there. I did a project that educated kindergartners, first, second, and third graders on what germs are, why you wash your hands, how bad flu is, why you get your flu shot. And so trying to start earlier on some of those important messages is really helpful. There are different educational things out there for young children as well.
I'd like to pick up on your question. I think it's really important. The question, in case it wasn't picked up on video, was, are kids educated about vaccines? If I could take it out of the clinical space into the educational space, if you don't mind, I think it'd be helpful. Many schools and many curricula do not directly address vaccination. It's a wonderful opportunity. Some people have thought about adolescent vaccination, in particular vaccinating 16-year-olds, which is what we're talking about for the second dose of meningitis vaccine. Some people have started to think about that as an opportunity for teaching kids to be in charge of their own health, having them understand what's going on. And that could happen at every single clinical visit, but it could also happen at the level of the school, helping them understand in this discrete situation, what does it mean to be in charge of your healthcare, to be engaged with what's going on, and to be thinking about what the costs and consequences are of not engaging this behavior. I think it's really a wonderful opportunity that our nation could take on as part of a lifetime approach to vaccination.
Children who go to college, okay, are they educated to go? Why are they getting it to go to college?
Oh, absolutely. At least in my college, they are. But typically, primary care physicians, pediatricians, whoever is taking care of the student, it's part of the law, actually. You have to present information to the student or to the patient who is there with you as to what the goals, what the risks are, possible side effects. All of those things are discussed before they're given.
Mm-hmm.
Thank you very much for your question. So I just wanted to thank all the panelists, and I have one more question that I just wanted to ask before we wrap up. A couple of you had mentioned a couple of different ways, text messages, things like that, but really, what are some innovative ways that we might be able to reach students and teenagers in order to equip them with the correct information?
I think default appointments are really interesting, so that when you enroll in college, you automatically have an appointment. Now, it sounds like you've also set up a stronger requirement, but for those places that don't have requirements, you could certainly set up a clinic where students would go and you send them an email or a text message or a letter and say, you have an appointment at this time to get the vaccines that you're missing. That's an effective way to increase vaccination that can increase rates by maybe 5 or 10%.
I think that from what I've seen, reaching out to teenagers and trying to get them educated is difficult because of the fact they're not taught a lot in public schools. Because I went to public school and they never talked about vaccines. And so there are probably some ways to change that, to approach that situation and make that better. But I think that social media, again, is one of the bigger ways to reach out because it's the growing, there's a just growing presence of teenagers continually becoming more and more, I guess you could say, exposed to social media at a younger age. And so that's like the prime time to teach them about vaccines. And so if you have any presence at all on social media and you're sharing information, answering questions, I think that's one of the more effective and even convenient ways to reach people.
I've always said I think it should be required learning in high school to take anatomy and physiology. It's sort of surprising as you're examining adolescents how sometimes they don't even know how their body works. And in studying immunology, you could definitely work on how vaccines work in that session. So I think there definitely is more we could do.
And a number of states have proposed legislation that would require any topic, we'll use vaccines, to be taught in school. So I think as clinicians, we have patients for a short amount of time. We have a window, per episode. And I think if they could get that information in a non-clinical setting where they have more time to understand the nuances of it, such as in school, I think that'll be very, very powerful. You can get into debate saying, how much are we legislating? How many mandates are there put on children in school? And that could be a debate for another day. But it is a perfect opportunity to talk about those things.
And we're working at our school to just get more of a presence in general about health. So we have students who are going to take over all of our social media. We will get a chance to view what's going to go out there, but then having discussions, stories, like I would say, put Ethan on a podcast, or right, and having continual stories so that there are faces, familiar faces, who can tell the stories that are going to be important and make them engage in washing their hands and getting enough sleep and getting vaccinations.
And quickly on that, I'd say as well, having younger people, especially representing that information, is really important. And I'm talking fast because I don't have a lot of time. But I think that when a younger person sees a doctor just being like, "Hello, I am Dr. Da-da-da," and like, "Here's the information I'm showing you on the screen," they don't really care. But if it's a teenager and they're like, "Hey, I'm this person, I'm a kid, I'm a high schooler, I'm a college student," they get a little more interested. And so we already see some groups doing that. I'm a part of a consortium, Unity Consortium. They do stuff like that. We filmed a video with Dr. Laura Offit, and with that, they were showing it through doctors' offices on like the screens and stuff, and that was really cool. But that was a good example of having myself as a younger person talking about vaccines in a way that was really simple, that was going to be shown at a doctor's office. And I think groups like that are specifically meant to reach adolescents are already pushing that movement of trying to reach those kids.
Great. Thank you so much. And thank you to all of you for being here today. And especially as a meningitis survivor and someone whose family has gone through this, we didn't know anything really about meningitis. I just hadn't quite gotten to my college physical yet to get the vaccine. So I really appreciate all the work that all of you have been doing and everything to try to get that information out and to help other families. So thank you again for being here. And just, we have about a 15-minute break before the next panel. So if you wanted to get up, get refreshments, or use the restroom, we'll be back around 11:15. Thank you.